Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Hydronephrosis, and we are looking at its causes. So hydronephrosis, it is divided into unilateral as well as the bilateral hydronephrosis. So first we are looking at into the unilateral hydronephrosis. So under unilateral there is an extramural obstruction. So there is extramural obstruction. So in this extramural obstruction there are presence of the tumor from adjacent structures. So tumor from the adjacent structures. So they include the cervix, prostate, the rectum, colon as well as the cecum. And there is also the presence of the retrocaval ureter. And there is the aberrant renal vessels. And there is also the idiopathic retroperitoneal fibrosis. Retroperitoneal fibrosis. So this is nothing but the Ormond's disease. Ormond's disease. Next we look into the intramural obstruction. So under the intramural obstruction, there is a congenital PUJ obstruction. So there is congenital PUJ obstruction. So this is most common congenital cause. This is the most common congenital cause. And there is also involvement of the congenital stenosis. There is uretrocele, ureteric strictures, and that is going to be iatrogenic and the inflammatory. Next is the neoplasm of the ureter or the bladder, of the ureter or the bladder, and this involves the ureteric orifice. Next we move on to the intraluminal obstruction. So it includes the renal stones. So this is most common unilateral cause. And there is a slouched papilla. And this is in terms of the papillary necrosis. And especially it is in patients with diabetes, analgesic abuse as well as sickle cell disease. So in patients with diabetes, analgesic abuse as well as a sickle cell disease. Next we move on to the bilateral hydronephrosis. So under the bilateral hydronephrosis there is congenital. So in congenital there is a posterior urethral valve, posterior urethral valve, and this is associated with pulmonary hypoplasia. This is associated with the pulmonary hypoplasia. And next there is also the urethral atresia. There is urethral atresia and the PUJ junction. PUJ is obstruction. So this is congenital, that is the posterior urethral valve. Associated with the pulmonary hypoplasia, there is urethral atresia as well as the PUJ obstruction. Next we move on to the acquired. So acquired, it includes the benign prostatic hypertrophy. So there is benign prostatic hypertrophy. or the carcinoma of the prostate. And there is the idiopathic retroperitoneal fibrosis. That is, it includes the hormones disease. There is a post-operative bladder neck scarring. Post-op bladder neck scarring. There is urethral stricture as well as the phimosis. To learn and grow daily like this, please do subscribe.